Welcome everyone, Maribel Nunez. Good evening and good welcome. And I just want to iterate what Ms. Astrid said. If folks have any questions, to put them on the chat, we'll have some Q&A in the very end of the program. Super excited of today's Latinx healthcare panel. And again, my name is Maribel Nunez. I'm the Executive Director of Inland Equity Partnership and Executive Board Member of Healthy California Now. This is an issue in regards to healthcare justice, a very personal issue. I'm a daughter of immigrants who definitely has been impacted firsthand and know how my community and family have been victims of our current healthcare system. So it's definitely an immigrant justice and Latino rights issue. Healthy California Now is a coalition of more than 60 healthcare and labor and community organizations fighting for single payer, a Medicare for all system in California. We believe healthcare system is broken and there's too many in our communities that are underinsured, uninsured. We did achieve the Affordable Care Act and we expanded coverage, provided subsidies to make healthcare more affordable. We expanded Medi-Cal for undocumented children to adults over 55. We expanded dental benefits under the Medi-Cal, but it's still not enough, This is a patchwork system that leaves many of our healthcare, with healthcare coverage that is too costly and inadequate. We also know that our community deals with major health disparities, and if it wasn't clear, and also in regards to COVID, it highlighted a lot of these disparities, exacerbated these disparities for sure. More than 50% of all COVID infections in California were Latinos, our hermanas, even though only we make up 39% of the population. We've had the highest rates of infections and deaths. We had about 38,868 Latinos that died out of COVID, making up 45.6% of all COVID deaths. I repeat, 38,860 Latinos dying due to COVID. And we consisted of 45% Californians. California's Latinos were 8 times more likely to live in households facing these higher exposure risks than white Californians, while testing for COVID-19 at a much lower rate than whites. We believe that healthcare is a public good, a fundamental human right. No matter your race, no matter your ethnicity, gender, sexual orientation, disability status, immigration status, income level, should never determine your access to healthcare or the kind of health outcomes that would come. Medicare for all, also known as single payer, would cover everyone for all medically necessary services, including hospitalizations. Visit the doctor's office, urgent care clinic, or emergency room, and preventative health like vaccines and cancer screenings, long-term care, mental health, reproductive health care, all these different services, right? Prescription drugs and medical supplies would all be covered. Can we afford Medicare for all? The answer is we can't afford not to transition to a single healthcare system. Too many lives, and we're spending too much and not getting too much in healthcare outcomes. The program would be funded, so how would we pay for it? Well, we're paying for it already. The program would be funded by combining our current sources of public funding, such as Medicare and Medicaid, and other revenue resources or sources. Folks on Medicare and Medi-Cal would have expanded services, gaps in benefits, and all out-of-pocket costs of prescriptions and services under Medicare would eliminate limitations on access and specialists under Medi-Cal. There will be no eligibility requirements for Medi-Cal, regardless of documentation status, and will be in one public government program with guaranteed benefits. Everybody in, nobody out. With all that being said today, we will hear from about the different health disparities within our Latino community, and we'll start with Dr. Anaya. Following Dr. Anaya's presentation, we will have an awesome Latino X panel discussing some of these issues. Labor icon, let's give a shout out to Ms. Dolores Huerta, Ada Briceño, co-president of Unite Here, Local 11, and chair of the Democratic Party of Orange County. Mr. David Campos, vice chair of Democratic Party and candidate for 8017. Myrna Melgar, San Francisco board member of Supervisors District 7. And Sasha R. Perez, Alhambra City Council member, District 4. As I said before, we will have a Q&A in the end. Put your questions on the chat. You could do also shout outs to our awesome panelists as well. And I will now hand it off to Dr. Anaya, who is from UCLA Center for Study of Latino and Culture. And a little background, Dr. Yohualli Balderas-Medina Anaya immigrated to Southern California from Mexico at the age of 4. Her background was deeply shaped by the goals as a physician. She's passionate about improving the health care and underserved and marginalized communities by utilizing innovative public healthcare programs, advocacy and public policy by means of physician workforce diversity in order to achieve health equity for all. She received a dual degree Doctor for Medicine and Master of Public Health from the Keck School of Medicine at USC. She completed her residency training at the UCLA Family Medicine Residency Program and subsequently joined the faculty. Her efforts in support for the health and safety and well-being of immigrant and undocumented communities. So let's take it away and give a shout out to Dr. Anaya. Pass it to you, Dr. Anaya.
Hi, everybody. Good evening. Thank you so much for having me. It's such an honor to be here with you. I serve various roles as an assistant professor in the Department of Family Medicine here at UCLA. I'm a primary care physician for a diverse patient population. I see patients at both UCLA and our county clinics. I teach residents and medical students, and I'm a researcher in health equity. And truly, it is an honor to be here with you all. And my goal is to share with you some of both the healthcare and health disparities that are affecting our Latinx and Latinx immigrant patient populations, and really get us thinking about what can we do to address those. So despite all the work that we've got left to be done, I will say I have to give us credit. Like, we have come a long way. When I was in medical school, we were over here. The curriculum very much focused on the poverty and the inequality that leads to health disparities. But now there is slowly but surely increasing understanding that the policies, economic systems, social hierarchies act as the structures that create and maintain both social inequities and health disparities. So we're able to identify these things as structural determinants of health. We have and continue to build this structural competency. And so hopefully we can use this to respond to those downstream effects of these structural determinants that are driving the health and health disparities of our communities. This is the approach that we can take in all of our various roles at all of our institutions to advance health equity. So I really like this model because this is a more complete lens than what we learned about years ago as cultural competency. Cultural competency can be problematic because in practice, it inadvertently tends to compound cookie cutter stereotyping of diverse patients. And it's tended to focus primarily on cultural barriers to care, framed in terms of race and ethnicity, and they often neglected those negative health effects of these political and economic forces, especially socioeconomic status that compound discrimination. And so instead, it changes our reference point to these structures and then pushing us to analyze how they produce and are maintaining the inequities that we're seeing along these social categories that we know as race and class. So we can apply this lens as we zoom into our Latino patient population. And as one example, Latino immigrants, understanding the structures that are the push and pull factors for immigration is one key element that really needs to be considered in the trajectory of immigrants and undocumented immigrants and the inequities that they face. So it's important to understand and not overlook the role that the US has played that's led to the context that has resulted in the immigration of populations and the resulting immigration status, which in turn plays a huge role in the Latino immigrant community's ability to achieve health. So this is where I was talking about, right? We were focused here on the right on this like poverty, the inequality, and then now we're focused here on the policies, the economic systems, the social hierarchies. Go ahead and keep clicking. This is our structural competency. And again, so thinking about what is the context that has led our Latino populations to immigrate and has led to their current status in their health. Continue. Okay, so here we are. So we've got a working age male. He has diabetes. He presented to my emergency room at our Santa Monica UCLA Medical Center. He presented with a foot wound, and my family medicine resident team was called to evaluate him. So next slide. Actually, stay there. Stay there. So the history that the ER obtains is that he's got an ulcer on his foot. It's been there for 4 months. He hasn't seen his primary care doctor in a while. He doesn't know what his diabetes control is. They've got an MRI to figure out, did this infection go to the bone? Is he gonna need an amputation? They've called podiatry. He's on antibiotics. He's admitted by my resident inpatient team. So go ahead in the next slide. So we come to evaluate him and get his story. And soon we find out that he actually developed the ulcer crushing soda cans. So as opposed to perhaps where our implicit framework may have taken us when we think about a patient with diabetes and the image of soda cans, it's not that he's been drinking a ton of soda, it's that he's been crushing cans to make ends meet. Next slide. So what are these higher level reasons for this? So these upstream factors that might be contributing to where our patient is when they present here today. So go ahead, next slide. And bear with me here, we're just gonna kind of click one at a time. So yeah, perfect. So he's in an emergency room, he's got diabetes, he's got high blood pressure, but what are the higher level reasons? So continue next. The COVID-19 pandemic, how did that affect this patient? Continue, next slide. So his clinic actually hasn't been seeing patients in person at that time, hadn't been seeing patients in person. Next slide. And so because of that, he hadn't seen a primary care doctor in months. He hadn't been evaluated. Nobody had been looking at his foot. Nobody had been able to do a foot exam because he was getting refills by the phone. Next slide. And because of the pandemic, he lost his job as a busboy at a local restaurant. Next slide. And so he resorted to recycling aluminum cans to make ends meet. Continue. How did he end up even needing to resort to recycling aluminum cans to make ends meet, right? So he used to be a 4th generation corn farmer in Oaxaca. Next. But because of the influx of cheap US corn, now he can't make a living in Mexico. So you know, again, these multiple factors, right, that have led to our patient presenting here into the ER today. Next. So let's take it another step further. Next. So why did we have influx cheap US corn? Because of policies and trade agreements. Next. And because of our healthcare system, and you know, as it was just very eloquently described, because this patient is under insured, he doesn't have access to care as we would want for all of our patients, right? Next slide. And because of racialized low wage labor markets here in the United States, US immigration policy, he is limited to these low wage jobs and needing to resort to things like recycling aluminum cans. Next. And as we know, and as you know, as was being discussed, we had a disparate effect of COVID on our communities of color. So, you know, our clinics needed to do a emergency response, and how did that affect our patients, right? And it disparately affected our patients, our Latino community. Next. So we kind of start to see how this man's outcome, how his future will be forever marred by not just the direct impact of the pandemic, but of how COVID-19 magnified all those structural vulnerabilities and inequities that he was already facing at these much higher levels, way beyond the control of perhaps the doctor that is evaluating him in the emergency room today, right? Next. So while you know, it's not to say or reinforce any assumptions that all Latinos are immigrants, because we know that the share of US Latinos who are immigrants is actually on the decline, understanding that health and healthcare disparities facing Latinos, understanding that also means understanding that as a result of the racialization of legal status, our Latino patients experience the burden of being designated into a subordinate status within the US's structure of social hierarchy, hierarchy, their structures of rights, the social structures of social belonging, and that spills over to many, if not all Latinos, regardless of their citizenship or their legal status. And so the research on health impacts of these policies suggests these several pathways through which they directly or indirectly contribute to health and health disparities. And these include affecting access to beneficial social institutions such as education, affecting access to healthcare, as we've been talking about, and the related services, constraining access to material conditions like food, like income, the working conditions, adequate housing, by designating, again, this the immigrant subordinate status within that organized structure of rights, which results in different treatment, discrimination, social inequality on those who hold the legal status, but also on those that are racial and ethnic in-group members, regardless of their legal status. And then last but not least, up here, you can see the stress that's produced by structural racism. So in addition to those well-documented effects that immigration policies have on limiting access to health and social services, the policies that are just like social and economic policies, right, also directly impact the fundamental causes of disease by shaping access or the lack thereof to life opportunities for our patients, whether it's access to higher education or access to well-compensated employment opportunities. And so they can be far-reaching, all of these policies, whether or not they're related to immigration, can be far-reaching in their ability to undermine the health and well-being of Latino patients, their families, their communities. Next slide. So while undocumented non-citizens face the most barriers, the policy context also influences the racialization of people of color who are documented, are US born, but who may experience that racial profiling, the discrimination, regardless of their status, right? And so our patients are vulnerable to what is an attributed status as a result, right? What their health-related deservingness, how much do they deserve to receive healthcare? And therefore, they can experience discrimination in their clinical visits with, in an outpatient, inpatient setting. And then they're subject to treatment also on the basis of their fit within the US's existing racial hierarchy. So perhaps immigrants racialized as Black or darker skinned receive different treatment than others, right? Next slide. So what can we do? Where are the opportunities to move towards equity for Latino and immigrant populations? Next slide. You might be familiar with this model. It's called the Socioecological Model, and it's useful for us in public health to identify points of intervention from the standpoint of public health professionals, community organizers, policymakers, healthcare workers, such as yourself. And so I'll go through a couple of examples at these various levels. Next slide. So first, next slide, public policy. As you already know, I don't have to preach to the choir here, universal healthcare coverage is a key component in an equitable approach to patients, especially patients who are in greatest need of healthcare services. Next slide. But now let's think at our healthcare system level, how can we work towards advancing equity more broadly at our healthcare system level? Next slide. So one opportunity that exists in our pursuit of health equity is the status of the US physician workforce and the long-standing workforce disparities and lack of representation of the diversity in our patient populations. Next slide. These are some results from a study that we recently published demonstrating that despite Latinos making up to like 40% of the population, right, in states like ours, or 49% in New Mexico, Latino physicians make up only this tiny little 6.3% of all physicians, and Latina physicians like myself, we make up only 2.4% of all physicians in the United States. And this was a study between 2014 and 2018. Next slide. And then while we are much more likely, so Latino physicians are 39 times more likely than non-Hispanic white male physicians to speak Spanish, Latina physicians 33 times more likely than a non-Hispanic white female physician to speak Spanish, but Latinx physicians are gravely underrepresented. Like I said, 6.3%, right? People like myself, 2.4% in the total physician workforce. Next slide. Studies show that disparities arise when patients do not speak the same language as their healthcare providers. And although Spanish is the language spoken most frequently in the United States after English, Spanish-speaking physicians are scarce. And our research shows here, highlighted, you can see in yellow, in California, Spanish-speaking physicians are the most underrepresented in the physician workforce. So a great opportunity that we have here, an area of opportunity. Next slide. So while the Latino population continues to grow, the supply of Latino physicians remains far, far behind. And the scarcity of Latino physicians has implications. It's beyond patient care, right? Of course, like that is a huge component, but even beyond that, right? In research, the people deciding what the research agenda, what we're going to study, the C-suite spaces, the people that are making the decisions around healthcare, we are unable to be represented because there's less than 46 Latino physicians for every 100,000 Latino Californians. So that Latino physician rate is nearly 90% lower than the non-Hispanic white rate in California. Next slide. When we look at our California's graduation rate of MD candidates, so medical students becoming physicians, right? The Latino physician shortage would not be filled for 5 centuries if, assuming we maintain at the current graduation rate of Latino new doctors. Next slide. So next, how do we improve the structures of our healthcare delivery? Yeah, perfect. I started working on the subject of telehealth as the very real but indirect, actually, impact of COVID on our clinics and on our patients was rapidly unfolding before our eyes. And so very quickly, we were seeing how many Latinos and other groups were being left behind by the sudden transition to telehealth with the onset of the pandemic. So not only were patients being affected by their own lack of devices, right? I didn't have a laptop, I don't have a computer at home, or perhaps broadband to support video visits, but also even by their providers' lack of equipment, right? Like, did the RFQHCs have the system to provide video visits? And so more broadly, with policy-related challenges were another issue. And so when care is provided at a distance, if some of our patients, for example, many Latinos, don't have access to video visits, but only to phone encounters, how equitable is the healthcare that we're providing to them if other populations have access to both, right? Next slide. So this is from a paper we recently published on strategies to improve telehealth care for Latino population. Thinking about, so rather than maintaining systems that are suboptimal for reaching our minority patients, we should think about how we can meet our patients where they already are, grounding our approach in equity. And that's what patient-centered care should mean. How do we focus telehealth delivery systems to provide patient-centered care that is really responsive to our patients' needs, to their preferences, to their socioeconomic conditions? What are we doing to respect the accessibility, preferences, the socioeconomic conditions of our patients? Next slide. At the institutional level, our academic institution, especially, though all, have great work to achieve. Next slide. Looking at the composition of our medical school graduates. So the racial and ethnic composition of our graduates differ significantly from the population demographics of California. So drawing your eyes here to the baby blue in the pie, you can see how small the piece of the pie is that represents Latinx medical students in comparison to this much larger piece of the pie that represents the Latinx California population. So again, we make up, as Latinos make up about 40% of the Californian population, but then only 11% of the physician graduates in that same year. Next slide. What about at our residency level? So we have medical students and they become physician residents, and then they become attending physicians that are full-fledged, able to practice on their own. So this training level of residency, we looked at the ratio of Latino resident physicians in relation to the population, the Latino population within states that have the largest Latino populations in the country. If you look at this red line here, we found that California has the worst Latino resident physician shortage among these states. States, and that the rate of physicians in the training workforce has largely remained stagnant over time. So you can see the red line hasn't moved. It's remained unchanged for these 16 years that we did this study over. And so we haven't made any improvements in these 16 years, in other words, here in California. Next slide. So this is why we're here today. Let us pave the road to health equity for our community. Let's build those organizational structures. That means we bring in more Latino physicians. We bring in more Latino medical students. Let's build the programs. Let's build these telehealth, I call it an ecosystem that actually respects our patients' socioeconomic conditions, their preferences, the fact that, you know, our patients use WhatsApp or maybe FaceTime, right? Let's do visits in the way that we can reach them. And then the policies, whether it's immigration policies, whether it's healthcare policies, let's do it in these various roads and combine to really support health equity. Next slide. And again, we have various levels to do this at. And so my hope is that you can kind of use this lens to think about how you can continue to build equity in health and healthcare, and hopefully inspire you as to some of the ways that we can start to make a difference. Next slide. Thank you for your time. Some acknowledgements here for the Center of the Study of Latino Health and Culture, the Latino Policy and Politics Initiative, both of whom which I've partnered with to do some of the work that we've discussed today, to my department, and to you all again. Next slide. Thank you for having me.
Thank you, Dr. Anaya, for that presentation. We definitely have a lot more work to do. I'm going to have Ada Briceño, who is the co-president of Unite Here 11 and also the chairwoman of the Democratic Party of Orange County. We will also have, sorry folks, I think we'll also have labor icon Dolores Huerta joining us in our panel. And we will also include David Campos, who's currently the chair of the California Democratic Party and also a candidate for Assembly District 17. We will have Councilmember Sasha Rene Perez from Alhambra. And then lastly, Supervisor Melgar from San Francisco. Great. And then helping us do this will also be Michael Soto. So just to introduce myself, my name is Astrid Campos. I am a political organizer with the National Union of Healthcare Workers. Once again, thank you for joining us. Remember, put questions in the chat. We'll have some time to answer them at the end. And then we're going to go ahead and kick it off with Michael.
Yeah, thank you, Astrid. And panelists, thank you all for being here. Supervisor Melgar, I know you were busy with board meeting earlier today, so we really appreciate you taking the time to join us here right after your meeting. It really means a lot to all of us here today. And then Dolores, I know you have to leave at 7. Your time is limited with us this evening, so we just wanted to start off with a question for you, which is rural communities have been suffering from healthcare deserts and a lack of doctors and other caregivers for years, and this has only become worse under COVID. So how would Medicare for All address these disparities, and what sort of positive changes would you see enacted in your community?
Well, as you know, it was said earlier that the Latino community has been very, very hard hit. I'm speaking to you right here from the Central Valley of California. I actually live in Kevin McCarthy's district, and the head of the Republicans in the House of Representatives, who has voted against everything, including Obamacare way back when. And, the one thing in all of our organizing work that we do, and we do grassroots organizing, meeting in people's homes, which of course has been curtailed now because of the pandemic. But when we meet with people, we ask them what is their number one concern that they have. It's always healthcare. Healthcare is one, education is two, and immigration is three, but in that order. So we know that this is a very grave concern, and that there's so much work that we have to do in terms of trying to get single payer, universal health care. I had the good fortune, by the way, and I have a little bit of bragging rights right now. I was with Governor Newsom this afternoon, where he announced that he is, as you may know, has put into the California budget money to cover all undocumented, okay, to kind of close that gap between the age of 26 and the age of 50. And of course, we know that this is really historic because California will be the first state that will be doing this. But at the same time, and by the way, this won't go into effect until 2024. But the one thing as a community organizer is the one thing that I do think that we really have to focus on is in prevention, because so many of the illnesses that like diabetes, hypertension, obesity that people have, we know is due, these are diseases that can be prevented or that they can be managed, that they don't have to come to the point where people lose their feet or their legs or that they die at a very early age because they have these particular illnesses. And so I would love to see, number one, when we get single payer, and maybe even before that, that we see more money is appropriated to do preventative health information and education so that our community can start learning how to protect themselves from these horrible illnesses. The other thing is, Dr. Anaya mentioned, we really have to push to make sure we can get more Latinos, not only to become doctors. By the way, I have a son who's a doctor. I have a daughter who's a nurse, and I have a granddaughter who's a nurse. And one of my grandsons is married to a nurse. So my family is so well protected because we have all these medical folks in our family. But my granddaughter, who was a nurse, I mean, she had to go through a lottery. And I remember several years ago that they said that we needed 400,000 nurses in California. And that was about 8 years ago that I recall. And I don't think that we have met that, like even here in Kern County, they have to go through a lottery. It's very hard to get into a class to become a nurse. I know that the governor, again, Governor Newsom has allocated more money in the last legislative session to provide training for more nurses. But again, we come to the issue where they don't have the money. They don't have the money to go to college. I think my son was very, very fortunate because he was able to get scholarships to both USC and UCLA and UCLA Medical School. Because as a community organizer at that time with the Farm Workers Union, there's no way that I could have paid for my son's medical education. And so I think this is one of the fundamentals that we have to address. We know that our Latino kids are talented, they're intelligent, but they don't have the support system that they need to be able to go to medical school, to become nurses and doctors and health practitioners. And the other area too that we really have to address is not only doctors that are practicing medicine, but we need psychologists. This is one area, psychiatrists. This is an area in our country. And when we think of the mental health issues that we have with the discrimination that people have to face, not only as people of color, and then double down on that one with the misogyny against women, that really makes it even more and more important. So when we talk about healthcare, we've got to mix in all of these different issues so that none of this can be left behind. So anyway, at least we have one step forward, and we got to thank the governor. We know this has to go through the legislature, but I know that the team that is on this Zoom is going to make sure that it passes the state legislature. And so that is one big gap that will be filled to be able to get healthcare for undocumented, which will not go into effect until 2024. But sí se puede, the first in the nation to cover all of our residents, including the undocumented, with healthcare.
100%. So much more work. Leading to that conversation, I think our next question is to our labor sister, Ada. You as a major union leader who represents hospitality and food workers who are predominantly Latino, how would a Medicare for All system impact your members at the table and in their lives?
Thank you so much, Astrid. I just want to really thank NUHW for taking so much leadership. And I want to say that I'm excited to be amongst such amazing panelists. And as Astrid said, we represent 32,000 folks across Southern California. Our members are the backbone of the hospitality industry. They're the room attendants and dishwashers who serve our hotels, stadiums, and airports. And really, Medicare for All would drastically change, in my opinion, the entire labor movement. I've been in negotiations, part of negotiations in one way or another since 1991. Our bargaining committees often lose sleep over healthcare. I've been arrested 6 times alongside other workers fighting for healthcare. And I'll just say that one of those times I was honored to be arrested with Dolores Huerta. And at Local 11, most of our contract disputes have been around healthcare. And we're not alone, and we know it. Healthcare is the biggest causes of union strikes, of lockouts, concession bargaining. Healthcare costs continue to rise much faster than wages and the rate of inflation. This forces unions to spend countless hours at the bargaining table, but this has forced unions to spend countless of hours at the bargaining table just to protect our benefits, just the benefits that we already have. But it's time to drastically change it. Medicare for All would eliminate a big percentage of our contract disputes. And most importantly, it would free us up to organize for fair wages, retirement benefits, and ending discrimination of all kinds on the job. And for newly organized workplaces, healthcare coverage is one of the most challenging areas in negotiations. If newly organized workplaces can take that off the bargaining table, we can reach wages and benefits that can build the middle class. We know that the labor movement is the only vehicle that exists to dismantle corporate greed in our country. And we've got to free it up and take the burden away from negotiating for healthcare to allow us to justly fight against the ills of corporate greed. You and I have witnessed the inspiring wave of strikes that have faced our nation. And it's because of the compression that our workers are feeling and the desire to fight against that corporate greed. And let's not mistake it. This is very much related to healthcare. Medicare for All would remove fear from workers to take on more collective action across our nation. If workers were not bound by their employer for healthcare, they could strive to reach the middle class. They can use their collective voice to come together and finally provide for their families and achieve the American dream. The resources that we currently use to protect our healthcare have got to be untapped and make sure that we can increase the amount of workers that have collective power, that have collective bargaining rights, and change the power dynamic for our workers. And that's why we've all got to be in for Medicare for All.
Next, we have a question for Vice Chair Campos. So David, you've been in office at multiple levels of government, at multiple levels of Democratic Party activism, and now you're running for state assembly and seeking to represent a majority Latino state. And we wanted to hear more about what your strategy is for helping lead us to Medicare for All, and how do we lead and make sure the Latino community is at the forefront of this conversation and not taking a backseat as our community has too often been placed in the past.
Thank you very much, Michael, and thank you again to NUHW for hosting this panel. And I am beyond honored to be among these incredible Latinas. Each and every one of these 4 amazing panelists has done so much. And Dolores Huerta, I mean, what can you say about Dolores? And I can tell you that I'm still trying to figure out if Dolores actually sleeps, because I've been in meetings with her like late at night, and she is on all the time. I don't know how she does it. She is superhuman. But listen, everyone has suffered during COVID, and there's no question that all of us, have been impacted in one way. And especially communities of color and Black and Brown communities have been devastated. The API community has been targeted for hate crimes because of, connected to COVID that were, fanned by Donald Trump. But I think that something has happened to the Latino community in particular. And that's why I think this forum is so important. The LA Times recently did a story about what has happened to the generation of Latinos that are age 20 to 54. And what it found is that this generation is 8 times more likely to die from COVID than their white counterparts in that same age group. That is devastating. And that is something that's going to have an effect for generations to come, because that means families being raised by single parents, kids growing up without both parents, and that impacts the economic future of those kids and their kids. I mean, this is going to have, long-lasting effects. And I honestly believe that in many respects, if there is any silver lining to COVID, is that it will finally push us as a community, the Latino community, the Latinx community, to really ask for the change that we need, that we deserve, to ask to be part of the political, powers that be in a way that we haven't been before. Our numbers are large, right? 40% of the population. And yet you wouldn't know that based on the representation that we have in the most important positions in state government in California. In San Francisco, I'm trying to make history by being the first Latino ever elected to represent San Francisco in the state legislature. And this is like over 200 years, and it's not like Latinos and Latinas were not in San Francisco. We have been a part of that city throughout, and that's what's playing itself out. And so I think this is really a remarkable moment for our community, and that we have to embrace Medicare for all as something that is not only critical, essential, but it's actually necessary for the survival of our community. The healthcare system that we have in place is not working anyone, but it's especially not working for the Latino community. And people are dying because of it. And I believe that one reason that's happening is because of the undue influence of the medical establishment, of the people that want this system to continue, of the corporate players that Ada talked about. It is those individuals that have so much power and are exerting their political power to keep the status quo as is. And so we have to fight them. And that's why I think that, people like me, as we're running for office, I'm running a corporate free campaign because I don't want to be entangled or persuaded by the political forces that to this day control many people in Sacramento. And so what I think needs to happen to have Medicare for all happen is we have to organize at a very basic level. I mean, Dolores Huerta is, the most effective organizer in the country today, right? And that's what she has shown us, right? That if you want something passed in places like Sacramento, you have to organize at the local level. We have to organize in each one of the 50 plus counties in California. And as we're organizing individually, we have to coordinate with each other so that we know what we're doing, because that's the only way we're going to get this through. So that's what I think is needed. That's why I'm running in San Francisco. And we just learned, by the way, that there is a big IE coming against me. And lo and behold, who's funding the IE? The medical establishment. You know, again, they don't want people who want change in power. And so, but I'm not afraid of it, because I know that we have the power. And if anything, if there's ever a time to make this happen, it is now, after this pandemic. And we owe it to that generation of Latinos and Latinas that has died at the numbers they have died. We owe it to them to make sure that that never happens again, especially to their kids and their grandkids.
Thank you, David. So true. A lot of money is opposing this, but this brings us to Supervisor Melgar. As a local, working in your community as supervisor and as a Latino leader, you know that Medicare for All would save millions of dollars in local government. What would you reinvest savings? How would you reinvest those savings back into the community if this was not a cost?
Thanks for the question, Astrid. And I just want to say, first of all, thank you for having me. I'm so excited to be here with all these really wonderful people with brilliant ideas. So I will refer back to Dr. Anaya's PowerPoint presentation, where she had all of the circles, around the personal, interpersonal, and where I would, if I had a magic wand, reinvest all of our savings for providing medical care to everyone who needed it, especially Latinos, is in the institutional and community spheres. Because we know that Latinos are disadvantaged economically in pretty much every way in California. And so in terms of our institutions and what leads to disparities in health, childhood obesity, lack of access to fresh food, disparities in terms of access to education and recreational space, everything that you can name down the line in terms of access to institutional assets, and then also community assets that Latinos don't have compared to other communities. That's where I would invest. But I'm going to make a special plug, and Dolores Huerta alluded to it earlier in her brilliant remarks, and that is that I would also focus investment into Latinas. In California, Latinas are the face of poverty. They are the lowest wage earners compared to white men. They are more likely to be head of households, single female head of households. They are more likely to get pregnant as teenagers than white girls. All down the line, there is a setup for Latinas to have the health disparities in addition to a lack of access to health. And for women, Latina women, access to health during the reproductive years is crucial because it sets up the economic foundation for their lives and also the lives of their children. And of course, we are seeing a Supreme Court that is trying to erode the access of women to fundamental healthcare and choice. And so we must invest institutionally into ways where women can be in control of their reproductive lives and to their the economic lives of their families, and into all of the things that make the community strong and healthy. Thanks for the question, Astrid.
Thank you.
Councilmember Perez, so I know me and you have talked at times just about how much our city and so many other cities just spend on the healthcare costs of their employees, past employees, and all the funds it restricts. And we just wanted to hear from you a little bit about what could we do if we were able to pass Medicare for all? How would we be able to use the funds we free up from our healthcare savings? And what would you like to do with those funds if it happened?
Yeah, thank you, Michael, for the question. First of all, I just want to thank the National Union of Healthcare Workers, as well as Healthy California Now, for putting this together and for inviting me to be a part of this incredible panel. There are so many folks that are part of this panel right now who I admire and look up to, especially Dolores Huerta. What an honor it is to share space with you. And so just really want to thank you all for putting this together. and for having Dr. Anaya present to you before this. I mean, that research and that presentation was incredibly eye-opening, just as we think long-term about our healthcare system and really about having a strong Latino workforce that is able to step into that system and serve our community. When I think about, you know, the amount of funds and extra funds that we would be able to reinvest, especially here at the local level, at the city level, you know, I think about all of the ways that we could better address health, right, as a community outside of our hospitals and outside of our traditional healthcare systems. Before I was a council member, many years ago, I used to work for the California Endowment with their Building Healthy Communities initiative. And through that initiative and working with them for several years, I learned to think about health really as, you know, this broader perspective, right? And to think about housing and to think about community resources and to think about, you know, environmental sustainability and all of these things that, you know, better serve a person and really serve, you know, the whole human being, to make sure that they're healthy and thriving. And health isn't just necessarily, you know, picking up your prescriptions at the doctor's office. It could also be, you know, whether or not you have access to affordable housing, whether or not you have access to clean water, whether or not you have access, you know, to basic things to civically participate in local government. And so, you know, here in Alhambra, there's so many things that I would love to do with extra dollars. You know, that would look like affordable housing. That could also look like us building out, you know, we have a community center that we've been needing to launch. You know, potentially our sustainability plan. We have a sustainability plan that, you know, has been in the works and has just been waiting for funding. There are so many things that local governments, and I know Supervisor Melgar, I see you shaking your head because you know exactly, you know, the challenge that we go through as local governments are constantly trying to look for funding and look for additional dollars to fund these big projects that we have ideas for. One of the big issues that we have, you know, here in the city of Alhambra is, you know, we have major issues with air quality. And that's because the 710 ends right in the middle of Alhambra. We have very poor transportation infrastructure. And we have tried as a city repeatedly to apply for grants so that we can improve our transportation infrastructure. And we have time and time again missed so many opportunities to receive those grants. And it's because, you know, we're a couple of points off, or, you know, there's just so many cities applying that are eager for that funding. And when you think about something like that, long term, this has an impact on people's health, right? The fact that we constantly have people in their cars idling, moving through our neighborhoods, trying to cut through traffic, that has ended up impacting overall air quality in Alhambra. So we have some of the worst air quality in the state. And so that impacts the lungs, you know, of our children. This is the air that our families have to breathe. And so all of these things are interconnected. And so, you know, I think having those additional dollars that our city would be able to save would allow us to actually invest in infrastructure that could impact and improve the health of our constituents in a really long-term way.
Valid point. I think everything is definitely connected, right? So in moving with that, I think everybody mentioned it in some way or another, right? There's multi-billion-dollar industry that is opposing single payer, right? That's going to fight against it. And we know all the barriers that within our own community we have to face. I know we are going to lose Dolores Huerta pretty soon, so I'm going to throw this out, and if you can't and you need to go, we definitely understand, but I'll leave it up to the other panelists to answer as well. But seeing as that you've seen some of, as a labor and civil rights leader who's been around to see a lot of these movements, how do you believe we can achieve single payer against such a giant, like, you know, these multi-billion-dollar corporations that are opposing single payer? What do we need to do?
Well, I think as labor organizers that are on here, and actually political individuals like David Campos and Ms. Melgar, and also Ms. Perez, we have to start thinking of the different ways that we can really start challenging and attacking this issue. I mean, it's like we shed a lot of tears and we complain, but we haven't really developed a plan. How do we go after these people, you know? I know back in the day with the farm workers, we did boycotts. I don't know if boycotts work or not. I know right now this is part of President Biden's plan on the Build Back Better Act to attack the pharmaceuticals. And because we know that people can get prescription drugs cheaper in Canada, they can get them cheaper in Mexico. And somehow here in the United States, it's this whole idea of profit driven and gouging people, you know, taking away their money. So we have to really develop a plan. I'm not saying that I know the answer, but we do know who the culprits are, right? We know who the culprits are, and so we have to design, how do we go after them? And we know that they have monopolies, so it's kind of hard to do this, but there must be a way that we can design or we can work on projects to say enough is enough. You know, a single payer might be one way that we can do that, because then we have, we're all together in one entity that we can start saying and start negotiating with these pharmaceutical monopolies as they exist. The other thing I do want to say is that, you know, when we talk about a national healthcare system, we know that in the United Kingdom, they've had a national healthcare since after World War II. Okay, we know that in Cuba, you know, every single person in Cuba has not only do they have free medical care, but they also have free college education. You know, this is a socialist country. And I would love to see us send a delegation to Cuba and come back with a report, okay? And maybe the UCLA might be one good place that can do it, because people here are so ignorant in the United States. And this is why I think they are not demanding that we have single payer or universal healthcare, because they don't even know that in Scandinavia, in the United Kingdom, in countries in Latin America, you know, that people have a healthcare system that is more affordable than the one that we have here in the United States of America. So we can keep talking about, as we have earlier, talking about the lack of doctors, and maybe we need to talk less about the problem and talk more about the solution.
Great point. Does one other panelist want to answer that? Oh, I saw Supervisor Melgar raise her hand first.
Yeah, thank you so much. And thank you for all that, Dolores. So I think there's a couple things that we need to do. First, I think that we need to get the labor movement behind universal healthcare. There was a professor at Northwestern who wrote a lot about how, as Dolores talked about, in Scandinavian countries and other countries in Europe, it's the labor movement that has put forward protections and healthcare and universal childcare and all these things. And in the US and even in California, we're not all on the same page yet, unfortunately. And the ability to, you know, cross that line and be able to, as a movement, push for something that is clearly in the best interest of all workers and all of us is something that we've got to do. And then the second thing that I will say is that we need to elect more pro-universal healthcare Latinos to office and support them. And, you know, we have one on the panel right here, but look, we're 40% of the population of California. And as of right now, only 10% of county supervisors are Latino across California. Only 12% of the California State Senate is Latino, only 25% of the Assembly. So it is kind of inexcusable. We need to be represented, but also we need to make sure that it's pro-universal healthcare Latinos who are elected and supported, and that we get them there to make the decisions that we need.
So then a question for Ada, just to bounce off of some of what Supervisor Melgar said. I mean, she's absolutely right. We need the labor movement on board. Ada, I know you've been at the forefront with HCN and others at really pushing other unions to join. And what do you think, what else is needed in order to get more of our union brothers and sisters on board? And what can rank and file union members or just activists do to help move labor to be on board on this?
Well, first I'll say that I couldn't agree more with Supervisor Melgar and also with Dolores. We need to have a comprehensive campaign. It's all those things that we've talked about, that plus more. Yes, it's boycotting, it's finding the strategic things that these corporations hold dear to them and going after them. That's what we have to do when we organize workers into the union, right? We've got to figure out how to yield strength. And so when it comes to our brothers and sisters in the labor movement, I really think that you've got to organize. It's one-on-one, folks. It is not complicated, while it's super complicated, right? It's having those difficult conversations. It's relationship driven as well. So organizations like NUHW, and they have done a really fantastic job, in building health, in building organizations that bring forth other like-minded, folks and bring us together to make sure that our message gets out there. So I know that having conversations with Michael, pushing me to, bring others to the table and to sign on for Medicare for All has been, some of the work that I've embarked on. And it is difficult. I can't say that, organizing is difficult in general, right? So it's just being at them and, just one person at a time, but it doesn't only take labor leaders to do that. It takes rank and file leaders, it takes organizers, it takes the whole labor movement, right? Talking to my fellow, does it end with talking to my fellow presidents at all the other unions? No, it's at every single level. Hearing the stories of our hotel workers was clearly impactful for me as a labor leader, understanding that we can't get ahead unless we deal with this issue. So there's got to be, there's got to be a push, from the bottom up and from the top down in order for us to bring others. But it does make a difference. And those folks that are taking the leadership, like NUHW and Unite Here and others, we've got to be loud and proud. And so because there are a few of us, we've got to stand out and and remind each other that we've got that obligation to do so. I wish I had a magic, list that we can all share amongst each other and we can get right to it and make it happen. But it's complicated and there are so many interests at hand, but we can unravel them one at a time.
Thank you, Ada. Now we have a question from David. I saw, did you want to answer that question as well? Well, moving on, we have a question from the audience, and we'll start off with Councilmember Perez. And so earlier, Dolores rightly pointed out that there's just a lack of Latino representation in the healthcare industry. So this person asked, how can we ensure, and Sasha, I figured this would be a good question for you since you do a lot of work in the higher ed space. So it's how can we ensure that student loans and unfair school systems aren't a barrier for more Latinx and Black folks wanting to become physicians? Seems like an entire reform to our education and medical system is required to provide equity to the medical force. And this question was from Jackie Hernandez. Thank you for asking that, Jackie.
I'm sorry, before you get started, I'm sorry, Dolores, I saw your hand up.
I just wanted to mention that today in today's press conference, Governor Newsom made the statement that he wants to start the manufacture of the insulin that people need for diabetes in California, to start making the medication right here. And I think that would be like an example to the rest of the world. The other thing is that I think of some of the labor unions, and maybe the next webinar, we should invite people from other unions to come and join the webinar here and talk about how labor unions, because I mean, when I was with the United Farm Workers, I was a trustee in our health plan, and we negotiated with doctors, and dentists to try to get their services lower for the farm workers. And also, I remember the money that people had to pay for a prescription was like $50. It was like unbelievable. Because we didn't have any middle persons, we got the money from the employers for our health plan, and then we paid the doctors and dentists, et cetera, for whatever medical services. We had no middleman. And I remember when we first had our by the way, our health plan was a Robert F. Kennedy health plan. We named it after Robert Kennedy. And our attorney said, well, who's going to manage your health care plan? And she just said, we are. And the attorney said, no, you've got to have somebody else do it. He said, no, he said, we can do it ourselves. And we did. So we didn't have any middle person in there managing our healthcare system. And the money came in and the money went out to the doctors, nurses, and for the prescriptions that people needed. And the other thing that we didn't mention, and I know everybody's going to say amen to this one, the obscene prices, the obscene salaries that these healthcare providers have. I mean, they have salaries that are like $1 million or more than $1 million. Really? I mean, this is something also that we have to address. Thank you for letting me interrupt.
Back to you, Sasha.
Yeah, well, thank you, Michael, and thank you, Jackie, for that question. That is right. Outside of my work as a city council member for the city of Alhambra, I'm also the public affairs director for the Campaign for College Opportunity. And so I work on higher ed policy full-time during the day. And we do have to completely revolutionize, our higher education systems. One of the biggest barriers to Latinx students being able to access higher education is cost. And oftentimes low-income students, first of all, don't realize that they're eligible for aid, especially our undocumented students. They don't realize that they can also be eligible for aid through the CADA. And so there are several bills that were passed just this last legislative cycle that will make it so that students are now going to have to fill out the FAFSA and the CADA before they graduate. That's going to be huge for many of our students that are coming out of our K-12 systems. On top of that, too, the California Student Aid Commission has been working very hard to try to expand the Cal Grant so that colleges and universities would be free to all low-income students in California. That was a bill that was up last year. It was AB 1456, and unfortunately, it did not pass. The governor did not sign off on it, but it is very likely. We've seen the governor's already made huge investments this year in higher education, more than ever before in the last 10 years. And we're very excited to see that. So we're hopeful that we're going to see some pretty big investments made into the financial aid space. And that in turn is also going to assist our Latinx students with then pursuing healthcare pathways, right? Because as many of you know, pursuing your doctorate degree, right, going to medical school, it's a very long, extended period of time to be in school. It is extremely expensive. And so, being able to know that those costs are going to be covered, especially if you're a low income student, is very important, right? Because for low income students, they are not just thinking about taking care of themselves when they're stepping into higher education. They're also thinking about taking care of their families, possibly, family at home. So making sure that that's taken care of is going to be really critical for us to really start building that workforce. And also getting that information out to students very early on, making sure that, adequate counseling is there so that students have the support and the information to understand that this is an option for them, that they can be a doctor, that they can be a physician, that this is a realistic pathway that a Latino student can actually, thrive in.
Completely true, right? They're all connected. And with this, I think many of us are facing these huge college debt. And so the younger generation wants to decide, is that something they want as well, right? And we know the pathways aren't there. There's not enough, COVID has shown us, right? There's not enough spaces to become nurses. I think Dolores talked about these lottery systems, right? So we have to reform. If we're going to be ready for a single payer system, we also have to create these pathways, right, to allow folks to get into it. And then how do we then increase as well? Like I think that Dr. Anaya said, right, having enough Latino doctors, and we need more women doctors, because she said that those were the ones who spoke Spanish the most, right? So a lot of things for us to keep in mind. I think, Michael, did you have another question?
No, I think we're all wrapped up. And then I think we just.
Oh yeah, I'm sorry,
Oh,
David.
yeah, of course.
Thank you. I just wanted to going back to what everyone said. I mean, I think there is so much intersectionality among all these issues, you know, and that's the challenge I think that we face as a community and as a state, is that we have to fight on many fronts. We have to fight on the, you know, healthcare for all, Medicare for all front to make that happen. But you cannot succeed if you're also not fighting for a better public school system that, you know, better funds K through 12, that also makes higher education affordable. Quite frankly, what Dolores said is true. You know, we should have college should be free for every Californian that wants it. And there are countries like Ireland and others that are less, by the way, wealthy than California that have made it possible. So we could make it possible. But there's also, you know, the need for more economic opportunities. You know, I'm glad that we have Build Back Better, but I actually think that the state of California should have its own recovery plan that builds upon Build Back Better. I mean, I've talked about something that, you know, maybe Build Back Fair, so that there is a focus on the communities that have been hurt the most by COVID, in the communities that have been hurt the most by pollution. You know, if we're going to have a Green New Deal for California, let's prioritize those communities. So that's the challenge, you know, that we have to fight on all these levels and we have to push for all these different issues. But I also think that with that challenge comes the opportunity to build coalitions, because there are so many different communities that are interested in these issues, and they themselves may not know the intersectionality of their issue with the issues that other people are fighting for. So I think this is a really unique time for California. I think it's a very scary time, but it's also an exciting time, you know, and that's the benefit of having the crisis that we're still living, is that it provides an opportunity for people to push themselves to do something different, to think outside the box. So if we're not going to think outside the box and change the system after a pandemic, then when will we? So let's take advantage of this opportunity, because I think people are craving for it, and I think the time for it is right.
Thank you, David. And you're so correct that there's so many other issues that come at the intersection of healthcare, and it's important that we help connect the dots for other people who don't see how these issues are connected and how it's affecting their community. And with that, I think that's all the questions we have. And now we just wanted to give all of our wonderful panelists just a couple minutes to make some closing remarks. And why don't we start with Dolores?
Thank you. Well, I think the one thing that we just have to remember, and it was said earlier, that in order to be able to get the legislation that we want, we're all going to have to work very, very hard, and not only in our own community, but reach out to other communities to put the pressure on the legislators to vote for the kind of a single payer or universal health care system, Medicare for all. You know, I had an aneurysm in the year 2000. And my hospital bill was almost $500,000, okay? But because I was over 65, guess what? Medicare paid for it. I mean, I had to pay a portion, but the portion that I paid was very doable. And that is the kind of healthcare that everybody should have. And it's achievable. You know, if we got Medicare for people over 65, we can get Medicare for everybody else. And it's just up to us to do the work to make it happen. Si se puede, and we have to remember, we've got the power, okay? We've got the power. The people have the power. Thank you.
Thank you, Dolores. Ada?
Yeah, I think that it is our collective responsibility to figure out how to have, how to grow the number of people who are backing Medicare for all, and how to make sure that we get it into the mainstream, and people will listen. But having spokespeople like Dolores Huerta and our other panelists really go a long way. So I like the chat. The chat encouraged other unions to figure out how to hold a panel. But does it really have to be unions? Because we had some we had some passionate people on the Zoom who have a network of folks and who can, bring speakers to make sure that their communities are aware of Medicare for all and why we deserve it and why we need it. So really, this is a campaign that's going to take us all, right? That's going to take every single one of us to really work very hard and get out of our comfort zone and grow from this experience. So I'm very excited for the people who join the Zoom and excited for what they can also bring, additionally into our movement and into winning Medicare for all.
Thank you, Ada. And you're so right. We all just need to get involved and use our networks. And if anyone, I really appreciate you encouraging other people to do a panel or other events of their own. And I'll just say quickly, if anyone needs help setting anything up, please reach out to Astrid or myself, or I believe Pilar Chiava is on here with the organizer for HCN, and we're more than happy to help you. So then I'll move on to Councilmember Perez.
I'll just go ahead and I think reiterate what both Dolores and Ada had shared, which is, it's really going to take all of us organizing in our own separate communities, right? Each of us really plays a huge role in helping to move Medicare for all and really making this an issue that people don't just support, but that they understand. I feel like when we often talk about this issue with folks, healthcare can be a very complicated subject, right? And so really understanding it or grasping why this is important can sometimes be really challenging. And I find what is most impactful when talking to other folks is storytelling and really sharing stories of families that have been impacted. And I think each and every one of us here probably knows somebody that has been negatively impacted by their lack of access to health insurance, right? Whether that be because they lost their job as a result of this pandemic, or because they just simply don't have insurance, and so they are constantly in this situation where they're avoiding getting the health care that they need, or going in to go visit a doctor. And by sharing these stories, and I think helping people to realize the real kind of human cost of this, I think it'll cause people to wake up and want to get further involved. And folks can also realize too that this is something that can very well happen to each and every one of us. I think we saw that with the pandemic, with some of the job losses that happened, right? Any one of us could lose our job, right? We could get laid off, something terrible could happen. And then we are suddenly in a situation where we no longer have coverage. And I think it's very easy to forget that many of us, right, and many of our families could easily be in this situation. I think another thing that, I often hear, and I have family that are Republicans. When I talk with them about this issue, the thing that immediately comes up is cost, right? This is going to cost $300 trillion, whatever number might be spouted on Fox News that day. And I really think us honing in on this cost savings idea is just so important. There's been so many studies that have been done on this now to show that there's some real cost savings that would come out of Medicare for all. I really think we need to better uplift those statistics and share that with folks so that we can really drum down on this narrative that this is just something we simply can't afford. And so I really think that that's how we get to the heart of this. And I think by doing that, while we're organizing and talking with our communities, we can really begin to change the narrative around Medicare for all and really build a constituency that is supportive of this, excited for this, that can then help elect folks that do support this kind of system.
Thank you, Council Member. And you're right, it's important we demystify healthcare, and we don't have to be policy experts to talk about it. And we should be comfortable talking about it. Supervisor Melgar.
Thank you so much. And I was just ditto to everything Sasha just said. I mean, the economic issues are clear, but I also wanted to say, this is a penny wise, pound foolish approach that we have, right? And we can talk about the economics, but also like the kind of world that we want to live in California, because the economics of healthcare and unexpected medical expenses are the driver of bankruptcy. Not just in California, but in America, right? And so much tragedy, so much misery, like people having their homes foreclosed on, ending up homeless, having, the mental stress, and then everything that comes with that, abuse, neglect, all of these things that go together in the spectrum of like, if we just invested in a healthcare system that was accessible and equitable, it would fix so many of our problems as a society. And it is economic, but it's also human. What kind of world do we want to live in and leave for our children? So I am excited that we're having this conversation, and I am looking forward to having folks in the assembly who believe in these things and can move it forward, but also to a movement coming together to do the right thing for the next generation, which is to implement Medicare for all.
Thank you. And thank you for bringing up, this isn't just economically right, but this is the morally right thing to do. And that's always the most important thing. And then David, we'll have you go next. And then Dolores, I see you have your hand up, so we'll finish up with you.
I think you want to give Dolores the last word on anything, by the way. It's always a good approach. But listen, it's been a challenging couple of years for all of us, right? And if you had thought about where we would be 3 years ago, I think none of us would have thought that we would have gone through what we just went through. And so I think that I think presents some perspective, because we have gone through something that no one thought was possible. And likewise, in response to that something, I think that we should push ourselves to rethink what is possible in our world. And I think that with a challenge comes opportunity. And I just want to make a couple of points. First is that the Latino community, the Latinx community in California, is a sleeping giant. We have large numbers, and we have so much talent. I mean, just look at the women on this panel, right? NUHW, the incredible organizers. My probably cousin Astrid, I don't know if we're related, but Astrid Campos, Michael, Isaiah, you have Supervisor Avalos. So much talent that our community has, and we have numbers. And if we are strategic, we can actually use that power to drive change. In looking at the legislature, the Latino caucus is not only the largest caucus in the California legislature, but it's actually the largest legislative caucus of any legislature in the country. So this should be an expectation that Latino caucus is going to lead on this issue. But I think that beyond that, I think that there is a unique opportunity for us to connect the dots in ways that we haven't. Labor has to be an important part of it. NUHW, Unite Here, other progressive unions are going to be a part of it. But I think that at the end of the day, the most important thing is that engagement at a grassroots level. There are 60 people right now who remain on the Zoom. At some point, we had over 100, right? If each one of those 100 people commits to engage another 100 people, can you imagine what is possible? And that's what I think is missing, is that the people that are the most impacted by this effort have not engaged fully yet. But I think that if we reach out to them, if we organize in the way that Dolores has taught us, I think that this is the time to get them to be involved in a way that they have never been involved, or they themselves may not even imagine is possible. So I think that we have that power within ourselves, but if we are unhappy about where things are, we have to recognize that we have to be a part of the solution. Do not be satisfied with where we are if you yourself have not taken upon yourself to be involved. So I'm very optimistic. I'm very excited about the prospect. I look forward to working with each and every one of you. And I'm certainly going to work very hard to make sure that I am that voice in the assembly that represents San Francisco. And we need to get other voices at all levels of government. So thank you for this opportunity. Let's make it happen. As Dolores said, we have the power. Let's use that power.
Thank you, David. Thank you for your comments. And I wanted to add to that, when we were at the last minute trying to get AB4 passed, and we got a call from Dr. Joaquin Arambula from Fresno County, and he said, we need support. Our members picked up 4,000 postcards in 1 week. In 1 week, 4,000 postcards, which we took to Sacramento and delivered them to the governor, okay? But the other comment I wanted to say, I have the, as Latinos, we have a lot of relatives. As some of my relatives work in the financial, high financial areas of some of these hospital chains. And 2 of them have told me this: the money that they have to pay out again to these insurance companies and to these middle managers is obscene, okay? Because they do absolutely nothing. They do absolutely nothing, but it's like they have to cut them a check for doing nothing. So we know that that is one of the problems, and that is one of the targets that we could actually put into our target range and say, we've got to get rid of these middle managers, and that would, again, save a big chunk of the healthcare cost. And I was very lucky because my 7 o'clock is just getting here right now, but I want to end with a, sí se puede, we can make it happen. Sí se puede. Muchas gracias. Thank you for inviting me.
Gracias.
Thank you, everyone. Thank you for joining us.
We did want to do just some closing reminders for folks. Thank you all. Thanks to all the panelists. Thanks. I love that all our panelists, our hermanas wore our red lipstick, knowing, we didn't let David or Michael know, but it's the color of power. So we want to thank the panelists for coming. We want to thank everybody for joining us, but we want to remind you there's a few other things that we can do as well as we continue on this fight, right? I think it was mentioned that there is savings in a single payer system, right? And I think we'll put it in the chat again, but there was an independent financial analysis that was conducted by the Healthy California for All Commission, and they found that there would be a $496 billion savings within spending or savings within the next 10 years if we moved into a Medicare for All system, right? So we know it's cheaper. We know there will be more, that there will be more access, more equitable access, and we know it will be better for our communities. And why a Medicare for All system? Because the current system that we have does not treat our whole body holistically, right? We forget about dental and vision, and in a Medicare for All, and also Dolores Huerta mentioned it, right? Mental health, right? We need to, our current system does not properly handle that, right? So this is important. What we can do for now, join Healthy California now, right? We put the link. If you're part of an organization, join as an organization. Put your name on the listserv, right? And we will get information out to you when our next meetings will be, because what we're waiting for right now is for the Healthy California for All Commission report. So the governor put a commission together, and they are writing a report that will lay the groundwork to hopefully a single payer system in California, right? But we need to speak up. And that should be coming out in the next month or two. So we welcome you to join us to get on that list, to make sure you get that information. And reminder for us, the way that we're going to achieve single payer, we have to think about it. California, Healthy California now has been working on a multi-track to win single payer reform, right? While legislation and ultimately a ballot measure will be critical component to achieve this, to achieve Medicare for all in California, many of the details will need to be worked out between Newsom and the Biden administration, right? Because we'll need to get a waiver from the federal government that allows California to use federal healthcare funds already flowing into California, right? To support publicly run program like Medicare for All, right? And so the upcoming report from the Healthy California for All Commission will be, vital in building those blocks for us to achieve that waiver, and for us to also, from what AB 1400 has laid out in the groundworks, right? And so for that, join Healthy California now, and we want to thank you. Us together, all of us working and organizing, we can achieve single payer in California. Gracias y buenas noches. Thank you, everybody.